To understand why talking about your family's health history can be beneficial, we talk with St. Charles County Community Health Nurse Teresa Turnbull. Thanks for joining us today, Teresa.
You're welcome. I'm glad to be here.
So why is it important to learn about your family health history?
Well, if we know our family health history, then we can relay that information to our physicians. And if you think back to when you see a physician and he asks you, what about certain diseases, and if you have any family history of those, there's a reason that he's asking that, he or she, because many times diseases such as heart disease or diabetes or asthma, some cancers, can run in a family, and even more rare diseases like sickle cell anemia or hemophilia, cystic fibrosis, those can also run in a family. So if our physician sees a tendency or a trend in a family, then he can better treat that person by going from their family health history. There's a lot of factors that go into a disease. Genetics is one of them that we can't change, but environmental factors and lifestyle changes, can be made if we know ahead of time what diseases we're trying to prevent or what we have a higher risk for.
And when we're talking with our family members, do we need to only talk to mom family or dad's side of the family, or do we need to talk to both?
Well, absolutely, we need to talk to both, because you have to include both sides of your family tree. And the genetic resource reference suggests that you have 3 generations for a complete family history for medical conditions, and that includes children and parents and siblings, aunts and uncles, nieces and nephews, cousins, and of course your grandparents. And since Thanksgiving is going to be just around the corner and we're going to be getting together with a lot of our family, it's going to provide a good opportunity to have these conversations. And in that, you want to make sure that you find out, any major medical conditions that affect any members of our family and the age that they were when those conditions were diagnosed, and of course any family deaths that have occurred, what the cause of death was, and also what age that person was when they died.
So after speaking with our family members at the next gathering that we have and learning this information, what should we do with it next?
Well, there's a lot of online tools that can help us to compile this information and organize it, and actually even put it into a presentation that can be printed out. From there, it should absolutely be shared with our physicians. That's one of the most important reasons that you should obtain a family health history. And you can also then share it with other members of your family, that may need to know that information also.
And you mentioned some of those resources available. What exactly are they, and could you give us those websites or phone numbers?
Yes. The Centers for Disease Control has a family history website, and that can be accessed by cdc.gov. The U.S. Surgeon General's Family History incentive is hhs.gov, can be accessed through there. And then the National Society for Genetics Counselors at nsgc.org are just some websites that have a lot of good information, can help you have online tools available to help you organize those resources. We can also get, by accessing, with someone's permission, of course, their medical records, or by searching obituaries and death records from our family history, that also can provide a lot of good information.
Thanks a lot for this information, Teresa. It's going to add a lot to our next family gathering.
Well, thanks, Doug, for inviting me, and I'm happy to provide the information.